what I have had is a couple of requests from students who are about to head out on placement. In particular, they're heading to hospital placements and they're just wondering how it all works, what to expect, how they can best prepare. So what I might do today is we're going to do a session focused on preparing for a hospital placement. What I'll do is I'll actually take you into your LMS because there's plenty of webinar recordings which will be really relevant to whichever placement you're about to go into, no matter what the setting is, because they're really focused on core OT skills that you'll need in any placement, but particularly hospital ones. So if you log in, basically once you're in, where I would start in terms of getting prepared, let's work our way through probably things that will be most helpful for you. So I did actually recently run a whole session on learning goals and CPD plans. So I click into this one just quickly. What it will actually do is it will encourage you to do like a SWOT analysis. So what are your strengths, weaknesses, opportunities within that placement setting, and any barriers or threats that could get in the way of you learning? There you go. There's also some ideas in that webinar for if you're really feeling lost, like how can you come up with some ideas, and it prompts you to look at what were your previous SPEF feedback, what are some of the competency frameworks you might come across, and just keeping in mind that you can have some draft goals, but you won't really lock them in probably till you've had a few days in your caseload and get a real feel for what you're going to encounter. What's also covered in that is in terms of how can you learn. So you need to reflect on what's worked for you before. Sometimes some supervisors are better than others at actually accommodating your learning style. So they may be someone that just, they like to learn by being thrown in. So they just do that to their students, whether or not that's how students get supported to learn it as well. So hopefully that doesn't happen to you. Hopefully your supervisor actually asks you, how do you like to learn? So have a think about it. Do you want to be just thrown in and work it out as you go? Do you want to see them do it? Do you want to do it with them supporting you alongside you? Just keep in mind that you can't say, I just want to watch you do it for half the placement. You've got to give yourself enough time to practice, and you're only going to learn if you do put yourself out there and do it. But it is sometimes helpful to watch it once or to have some time to prepare and do your own self-directed learning. You can ask your supervisor about that. So that's a good one to look at in terms of just the learning goals and how you're going to learn specific for your placement. So those sorts of things might be helpful. Reflection, it's really one of those things where some students roll their eyes, but you're not going to be able to really learn well unless you can do something, then stop thinking about it. Why did that work? Why didn't that work? What could I do better? It doesn't need to be a Gibbs reflective cycle like they often teach you at university. In that webinar, I talk about some other resources, and I've created one that's lots more prompted, lots more ideas if you really feel like you've got a blank mind when you're trying to do reflection. But that could be helpful to look at as when you're preparing for supervision sessions, if you've really thought about what's hard for you, what's working well, how they can help you, then you're going to get more out of the supervision session. So that could be helpful there. This one is helpful in terms of just understanding how the OT process looks, and that there's, even if it just looks like on the surface your supervisor is, oh, yep, this person has difficulty with showering, they went and got them a shower chair. There could be, hopefully, there's all these extra things that are going through your supervisor's mind before they come up with exactly what shower chair they recommend, plus why they're also maybe considering other things that might be impacting showering. So that's a bit of a case study example, which will show you that when you're watching your supervisor do something, that you're thinking a little bit more deeper than the surface level, and that it's not showering difficulty equals shower chair. It's showering difficulty equals consider this, consider that, consider all these different things, and then the solution may be a shower chair, or it could be this. And that's just a bit of a case study example to show you. Community setting, obviously, if you're going to community, you can look at that. There is an OT process in the hospital setting coming a little bit later this year. So depending on when you're watching this, it could be updated. Remember, I'm recording this in August. So if you're watching this well after that, after August 2025, there could be a lot more webinars in here that are relevant for you. EBP could be helpful if you go into a placement where your supervisors are really big on talking about what's the evidence behind these things, why would I choose to do this and not this, or the evidence says to do it this way, why would I be doing it differently? That could come up a lot actually in a rehab ward, particularly maybe around stroke rehab, where there's lots of different ways that we could be doing maybe upper limb therapy, either ES or constraint-induced movement therapy or repetitive task practice, mirror therapy or mental imagery, I think is what they call it. So you might want to really have a good understanding of what are the stroke guidelines, where can I find them? How does that then fit if what the stroke guidelines are telling me to do, I'm seeing something different? So that could just help you visualize all those sorts of things. Connect and collaborate. So there's a few short videos here. This one, when you don't know the answer to your client's question, could be helpful because it could be your supervisor sends you off to, yep, just go do that initial assessment or just go do that assessment. And then they think you're fine with that, but then you get asked a random curly question that from the patient that you weren't expecting. how will you actually respond to that? So that just gives you like a bit of a quick demonstration on maybe how not to respond, but also a way that you can respond and pretty much just buy yourself some time to go speak to your supervisor. So that's worth watching. Clinical handover is really important in a hospital setting. And you may even see that some hospital wards will operate where they do like a team handover in the morning where everyone gathers around the nurse's station. They go run through where everybody's at. And sometimes we'll actually use this ISBAR, or sometimes it's ISABAR, depending on where you are, but some sort of framework for actually succinctly just talking about each patient. But if your expectation is, and if you're fourth years, probably be the expectation that there's going to be a case conference with the whole team, and eventually you'll be maybe presenting one of your patients to the team, then this can be helpful for you to actually do that succinctly so you don't just waffle on, and you can cover the most important things about that patient. And it's also a really helpful framework for when you're sitting down in a supervision session with your supervisor and they're like, okay, tell me where Mrs. Smith is up to, that you don't just start randomly in the middle with a question. You actually give the background, the important information, explain what you've done, and then say, this is what I think I'm going to do. What do you think? And ask your question or for whatever it is you need to find out. So that's helpful if you're someone that feels a bit tongue-tied whenever you have to go speak to a physio or a doctor, or your supervisor asks you to explain where you're up to and you're like, I don't know where to start. That could be really helpful. There's a download in there and some examples so that you can go through. If you're a fresh OT student that's going out one of your first student placements or a completely new role and you're like, I have no idea how to explain what I'm going to do, it's often the first thing the supervisors will pass over to you to have a go at is to introduce yourselves to the patient and explain the OT role. This gives you a bit of a framework in terms of what sort of things should I put in that explanation? How can I make it sound a bit more natural, and how can I not just talk at the person, but really try to build in what they already know about OT, or maybe what they're concerned about with OT as part of that introduction. So again, you can have a look at that, a little bit of a step-by-step worksheet for you. Definitely if you go into a hospital placement before and you really don't have any understanding of what speeches do, physios do, social workers, or like all the different levels of nurses and doctors, then definitely have a look at this one, understanding the multidisciplinary team, because hospitals generally were working really close, and particularly in a rehab ward. So if you come across an issue that your client's experiencing, you want to know who you can refer on to or who you need to speak to about it. And even down to the level of if there's all these different levels of nurses or doctors, who do you actually discuss your concerns with if you need to give that feedback or a handover to somebody? So they'll give you an understanding of the different levels, but every hospital is a bit different. Some hospitals will have like really strict unwritten hierarchy type rules where all students never approach the neuro specialist that comes and visits. That's only the senior OTs can do that. Whereas other wards are very open, and the neurologist may actually welcome you and ask you a question about your client and actually include you in that. So it's good to sometimes ask your supervisor in terms of what are the expectations for your participation level, or is there somebody that I need to see, or if I'm coming onto a new ward, does the NUM always like that person to come and introduce themselves before just rocking up and going to see a patient? There's sometimes all these unwritten rules and just different hierarchies and the way people like to work, which if you can be on the front foot and not do things inadvertently to upset people, it just makes your life a lot easier. So hopefully if you've got a supervisor who's aware of some of those things as well and can actually say, oh, yep, that physio is great to talk to, but don't interrupt them when they're running this group, or don't get to them in the 5 minutes before this group because they're always really busy and it won't go well, then those sort of little tips can be really helpful. OT detective, definitely if you go into a hospital placement, whether it's rehab or inpatient acute, watch this one if you've never seen an OT hospital assessment before. It's going to be a little bit different, and particularly in a rehab ward. The hospital acute OT may have already done the full initial focused on what are the discharge goals, and maybe your rehab focused ones is a little bit different and breaks down that more, what are we actually going to be working on rather than what's the minimum we need to do to go home. So it may be slightly different, but often hospitals will actually have their own templates. Or you could ask your supervisor to have a look at any previous examples of initial assessments that have been done in that ward. Because even though, like, I've got also a follow-up one on how you document it, the way I do it could be very different to the way your supervisor expects it to be done, or the way that it's done within that hospital. So hopefully mine's a bit of a starting point, but yeah, everybody's a bit different in terms of how strict they are in terms of how they would like you to document. So always default to whatever your supervisor's expectations are to get through that placement. Once you're not a student anymore and you'll have a different supervisor, you may find that they're not as strict in terms of how you document and you can develop your own styles. The Barthel Index does come up in some rehab wards, so some of the criteria depending which state you're in. I know in New South Wales Health, that used to be one of the tools that OTs would have to do for somebody if they wanted to access like a transitional rehab type package where they'd leave hospital and then have ongoing OT physio for 12 weeks. We'd have to do it as a baseline. So if you need to know about that tool, you can look at that. Often OTs again will do some cognitive assessment. So either some standardized ones like the mini mental or the mocker or something like that, but also non-standardized, which particularly could come up in an acute ward where there's more neurotype rehab happening, where you're looking at somebody's functional cognition from something really basic. Can they follow instructions to put some hand cream on their hand to can they actually prepare a fairly decent meal? Maybe you've actually got access to an ADL kitchen and there's breakfast club or there's something like that. Some ideas there in terms of what to think about for non-standardized. I think it's one of the longer ones because there is a lot of detail in that. So it's not the usual half hour, 45 minute. I think it goes over an hour, that one. Standardized cognitive assessments, yeah, you could ask your supervisors, do you do any of those? Do you do mockers, mini mentors, ACE, others? This will just help you through some of the differences. So you can have a look and see whether what they're using is similar to that. And it'll give you, it doesn't go through this is what it looks like, but it'll go through some of the key suggestions. And there's an example again of how you could write it up in terms of documentation. This one's more sort of all your different treatment things. If for some reason you're needing to write NDIS reports in a hospital ward, this could be helpful, but otherwise it's more of a community OT to worry about. This could be helpful in terms of when and why to do a home visit. It was a recent one that I've done earlier in August. So sometimes we're like, okay, this person needs a home visit, but it's really time consuming. How do we know that we definitely need to go out to the home, that we definitely need to take the client or the patient or not take the patient? Is there any other ways to do it? So this will actually take you through a bit of a framework for you to think through your clinical reasoning in terms of what's the most efficient way that I can do this or not do a home visit and still get all the same outcome. This one's really helpful, so providing education about assistive technology. So chances are in a rehab ward, someone's going home with some AT or equipment, whether it's basic shower chair or something more complex like a hospital bed or air mattress or cushion. This will just, again, give you a framework for what sort of things do I need to include when I'm providing education to somebody. And it goes through things like the actual setup, any risks or things to be aware of, how you actually maintain it, what they do if they have any questions. So that sort of thing, again, worksheet checklist to help you do that. Documenting basic treatment. So this may actually, I think, go through like soap versus non-soap. Again, every hospital will be different. You just go with whatever the hospital and your supervisor says you need to do. So wherever possible, try and ask for some examples that you can use. Some people are still handwriting notes. A lot of states have transitioned over to electronic medical records where they may actually have built-in templates with the subheadings and you're just filling in the blanks. So very different, but the ideas of things to consider will be covered in that. Client education is similar to the AT education, but it's not specific to AT. So it could be more relevant if in your caseload you do lots of falls prevention education or someone's going home with pressure care risk and you need to provide them education about their pressure care injury or saving energy. So energy conservation type information that could be helpful to look at. Again, gives you some things to think about, not just in terms of how do I do it, but thinking about how much knowledge your patient already has, how much brain space they have to absorb information so that you don't just give them heaps of information and then wonder why they can't remember any of it. And even thinking about where they are in terms of their journey, in terms of stages of change. If you're trying to introduce some new behaviors, how ready are they to embrace that? So like how ready are they to want to actually start implementing all these different falls prevention strategies or energy conservation strategies? How ready are they to start using all these new pressure injury management strategies if they're not really even aware what a pressure injury is and the risks that are associated with that? So that's good just to think about, yeah, what you're delivering, how you're delivering it. So again, not just talking to people, but or going straight to a default, let's get a handout, but what else is going to be helpful to them? Is there some YouTube videos that like reputable people have put together, which could be like more visual in terms of supporting their learning? So things to think about there. Pressure care management probably will come up at some point for most hospital OTs, but again, it could depend on your caseload. But if you've got a patient that's going home and their mobility is a bit restricted, or they've got really fragile skin, they've got a hemiplegia and they're needing assistance with transfers, then they could be at risk of needing pressure injury management. So that will just give you, again, some things to consider and some of the key areas that we might focus on and some resources behind that. I think it's another long one as well, lots of detail. Try to keep it as short as I can, but lots of important things to know. And raise the bar. Not too relevant, but if for some reason you actually, so some placements will say, okay, your supervisor only works part-time, so on Fridays you'll be doing a project instead of actually going to the wards and doing things. This quality improvement cycle in action webinar could be really helpful so that you're thinking about it not just in terms of, oh, they say that the patients need an education handout, let me just go and create that education handout. There's actually a process you can go through so that you can actually do that really effectively so that you can deliver the education that your clients or patients really want. Same as if they're like, yep, can you create a new group session for our falls prevention group? You can start from the start in terms of making sure that you're actually addressing the gap that your clients actually want and delivering it the way that they want it. You're actually doing a bit of a test and evaluating it before you just create something and go, yep, there you go, it's done. So that could be helpful, maybe impress your supervisors if you get an understanding of what sort of the good QI cycle is and then try and implement it. Just keep in mind what sort of time frame you've got. So even if it's, oh, yeah, do this brilliant, interview your stakeholders, your patients first, and then do this trial and do that. If they said, can you just put this together with, you've only got a few hours over the next couple of weeks to work on it, you may not be able to do all that. But if you're aware of at least what would be ideal, you might be able to pick out the key elements where it's okay, I'll put something together quickly after a quick literature review, and then I'm going to at least show it to 3 people. I don't have time to do the big trial I would have liked, but if I can show it to 3 patients and get some feedback, then I'll feel a little bit more confident. So those sorts of things could be helpful. That, in a nutshell, is probably what you'll find in your Connector membership. If there's something in particular that you think would be helpful that I haven't covered, have a check at what's coming up in the program. It might come up before your placement's finished. Otherwise, you're welcome to send me an email. We might be able to drop it into the next Q&A session and I can cover it there. Or if it's really urgent and I can quickly respond via an email and point you in the right direction, I'm happy to do that. So just let me know. But I'll stop sharing that for now. Hopefully that's given you a bit of a starting point, probably too much of a starting point in terms of where do I actually start. So lots of information there. So like I said, reach out to your supervisors, find out a little bit more about exactly where you're heading and what to expect, and then compare that with what your day is going to be and what it's going to involve. Compare that to actually like your previous SPEF results or your feedback from supervisors in terms of where you could improve. So if they gave lots of feedback that your documentation is fine, maybe don't worry about spending too much time looking at the documentation webinars. If they've said that you really could improve your confidence with talking with the other team members or with your communication, maybe look at that multidisciplinary team webinar and also the communication webinar. So combination of what are you going to expect and what's likely to be challenging for you because you've spoken to your supervisor, reflect on what's been difficult in previous placements, and then try to have a look through which one of those webinars might be helpful. And whatever you remember, you can access them as many times as you like. So keep the membership going during your replacement, and you don't need to necessarily know all this and absorb all this before you go to your placement, but knowing what's available so you can quickly access it in your self-directed learning time could be helpful as well. And it's probably worth mentioning to your supervisor that you do have access to this on your placements. And if your supervisor, wow, this looks awesome, how did you get this? You're more than welcome to pass on my details to your supervisor because supervisors can actually purchase access for students as well. So obviously don't just start logging in without asking permission because any sort of online things, sometimes there's different security settings and things that you can and can't access. So just if they've been giving you free rein to go sort out your own self-directed learning and you think this could actually be relevant for you to be looking at during your placement time in that self-directed learning time, have a chat to your supervisor so that they actually give the okay to do it. And if not, if there's no time to fit it in or that just for whatever reason it's not appropriate, go nuts and do some binge watching outside your placements, but just make sure you do actually give yourself time to have a bit of a rest. It's very overwhelming. There's lots to think about. Often students are also trying to fit in some work after hours or on weekends. So do what you need to do to feel comfortable with what you're learning, but give yourself some time off as well. But hopefully that was helpful. Good luck with your placements, and I'll maybe see you at a future live session. See you later.